Hi friends, I am Dr. Mangal Gupta. Welcome all of you on your own network, Dentist on Camera. Here I am showing you a case of severe gingivitis, heavy deposit of calculus and plaque. Here patient tell a story. My gums bleed when I brush my teeth every day. Then I stop brushing and condition getting more worse like this. Actually, gingivitis is the most common cause of bleeding gum. By considerable margin, gingivitis is the initial stage of periodontal disease. And bleeding on the brushing is an important sign of gingival inflammation. If you have suffering from these signs, immediately contact your nearest dentist. Here I am removing all the calculus, plaque, biofilm by the special instrument called ultrasonic scaler. Keep in mind, this is not drill. You may say it water sprayer in common term. Scaling and root planning removes subgingival calculus, supragingival calculus and plaque, disturb the biofilm and free the root surface of combination from the microbes and bioproducts. It's one of the most common periodontal procedure, effective and non-surgical therapy. If deposition is very heavy, then patient usually experience mild aching and thrombing after scaling and root planning is completed. The patient also feels slight swelling which is settled down after 2 to 5 days. After that, condition is very good and you are free from this disease. Thank you friends for giving your valuable time. Keep smiling.